Before and after breast surgery information tool. Hello, my name is Lynn Penberthy Ritchie. I am a nurse in the St. Michael's Hospital CIBC Breast Center in Toronto. I have been working with breast cancer patients for 17 years. The purpose of this tool is to tell you about the kinds of medical appointments you might have related to your surgery. I am also going to tell you about how to prepare yourself before breast surgery and how to care for yourself after breast surgery. What is some information that might be important for you to know before surgery? Before your surgery, you will get a call from the surgeon's office that will tell you the date and time of your surgery, where to go on the day of your surgery, and the date and time of your pre-admission appointment. Your pre-admission appointment. When is it? Usually, your pre-admission appointment takes place a week before your surgery. What happens at this appointment? You may have some tests done. The information from these tests will help your healthcare team help you get ready for surgery. You may need to show the nurse the bottles of medications and supplements, for example vitamins, that you take every day. The nurse will then tell you which medications or supplements you should take the morning of your surgery. What should you know the night before and day of surgery? On the night before and day of your surgery, remember you should not eat food or drink fluids starting from midnight on the night before your surgery. Most breast surgeries take only a few hours. It is possible that you will be going home the same day. You will also leave the hospital with a prescription for pain medication in case you need it. After surgery, you must have someone to take you home from the hospital. It would be a good idea to have someone in your home to help you during the first few days after surgery. What should you know about coming home after surgery? Once you are home after surgery, remember, most people can do many of their daily activities the day after surgery. You can use your arm after surgery. You do not need to protect it. But you should not lift, pull, or push anything heavier than 10 pounds, which is equal to the weight of a sack of potatoes, for a few days. What should you expect after surgery? It is normal to feel like there is fluid sloshing or jiggling in your breast. This will go away after some time. It is also normal to have a little swelling or tingling for a few weeks. Problems and infections are rare, but you should call your doctor if after a few days you have a bad smell or pus from the wound, fever, more pain, or bright red bleeding from the wound. What should you know about caring for your wound after surgery? You will be given instructions on how to care for your wound, such as you can remove the dressing on your wound and take a shower by the third day after surgery. At this point, you will not need to put the dressing back on. If you would like to, you can take a sponge bath before it is time to remove the dressing. If you want to wash your hair, you can do it in the sink or use dry shampoo. But please make sure you keep the dressing dry. You also need to remember, keep your wound area clean. This means you should not apply creams, lotions, oils, polysporin, or any other kind of antibacterial cream to the wound. If you have little strips of tape under the dressing, do not take those off. Let the strips fall off on their own. What should you know about having drains in place after surgery? If you have drains in place after surgery, you should remember the hospital will arrange for you to have a home care nurse visit you where you live. The nurse will teach you how to take care of your dressing and drains. What should you know about your appointment with the surgeon after breast surgery? It will be important to remember when this appointment will take place. You will probably have an appointment with the surgeon about 2 weeks after your surgery. The surgeon will give you a lot of information at this appointment. It would be helpful to bring another person with you to listen to the information and to give you support. What will happen at this appointment? The surgeon will discuss all the information from your surgery with you. This is what your healthcare team will use to plan any additional treatment you might need. For example, chemotherapy, radiation, hormone therapy, or more surgery. Remember, it is okay to call your healthcare team and ask questions. If you are unsure about something, call your surgeon's office during the week. Lymphedema. What should you know about lymphedema? Lymphedema is the swelling that can occur in the arm or chest after the lymph nodes are removed during surgery. The swelling happens because there is extra fluid in your arm or chest. When should you talk to your doctor about lymphedema? Surgery can increase your risk of lymphedema. That is why it is important to tell your doctor if your arm or chest feels full, heavy, or tight, has tingling that does not go away, or hurts or aches. If you have lymphedema or are experiencing symptoms, speak with your surgeon, nurse, and/or patient navigator for more information on how to manage it. Remember, it might help to keep your arm raised on a pillow and to move it often. What should you know about your diet after surgery? It is important to have a healthy diet, especially after surgery. Do not change your diet if you are eating from these major food groups: fruits and vegetables, milk and dairy, bread and cereals, meat and other protein. A healthy diet that has protein in it should help you heal after surgery. If you are not eating a balanced diet, then please start using Canada's Food Guide at the time of your diagnosis or after your surgery. If you have more questions about lymphedema or diet, contact your clinic nurse or patient navigator. Thank you for watching.